1 in 5 adults in the United States is currently living with a mental health condition. That is roughly 57 million people. And yet, for most of human history, those 57 million people would have been told to simply push through it, pray harder, or worse, they would have been locked away and forgotten. Something massive has shifted. And we are living right inside that shift. In the next 10 minutes, you are going to understand exactly why mental health has exploded into the cultural conversation, what the science actually says about the crisis we are facing, and why the old ways of dealing with psychological pain are being torn down and rebuilt from scratch. There is one finding buried in recent research that completely rewrites how we think about who gets mentally ill and why. Most people have no idea it exists. Let us go back to the beginning. For most of recorded history, mental illness was not treated as a medical problem at all. Ancient civilizations believed that psychological suffering was caused by demonic possession, spiritual punishment, or moral weakness. Treatments ranged from prayer rituals to trepanation, which is the practice of drilling holes in the skull to let evil spirits escape. Even as recently as the 19th century, people experiencing depression, anxiety, or psychosis were institutionalized in asylums where conditions were often brutal and inhumane. The 20th century brought slow but meaningful change. Sigmund Freud introduced the idea that psychological suffering had internal, unconscious roots. The first antidepressants were discovered almost accidentally in the 1950s. In 1973, the American Psychiatric Association removed homosexuality from its list of mental disorders, a moment that signaled the field was finally beginning to untangle mental illness from moral judgment. The Diagnostic and Statistical Manual of Mental Disorders, known as the DSM, was continuously revised to reflect growing scientific understanding. But awareness did not equal acceptance. For decades, even as treatments improved, the stigma remained crushing. People hid their diagnoses, skipped their medication, and suffered in silence because admitting you were struggling still carried enormous social consequences. So what changed? Why is mental health suddenly everywhere? The answer involves three converging forces that hit at roughly the same time. Social media created a platform where people could share their experiences anonymously and at scale. A generation of celebrities began speaking openly about their own struggles. And then the COVID-19 pandemic arrived and broke the system completely. Between 2020 and 2021, rates of anxiety and depression worldwide increased by more than 25%, according to a landmark study published in The Lancet. That is not a gradual trend. That is a shockwave. Suddenly, mental health was not something that happened to other people. It was happening to everyone, at the same time, in real time. The collective trauma of isolation, loss, and uncertainty stripped away whatever denial people had been holding on to. But here's what nobody talks about. The mental health crisis was not created by the pandemic. The pandemic revealed it. Research shows that even before COVID, suicide rates in the United States had increased by 35% between 2000 and 2018. Youth mental health had been declining steadily since at least 2012. The infrastructure to handle this had been crumbling for years. What the pandemic did was make the invisible undeniable. The numbers among young people are particularly alarming. The Centers for Disease Control reported in 2023 that nearly 3 in 5 teenage girls in the United States said they felt persistently sad or hopeless. That is the highest level ever recorded. Emergency room visits for self-harm among adolescents doubled in the years following the onset of the pandemic compared to the decade before. These are not statistics to scroll past. They represent an entire generation that is struggling in ways previous generations simply did not report. And there is significant debate about why. Some researchers point directly to social media. Jean Twenge, a psychologist at San Diego State University, found a sharp correlation between the rise of smartphone use and declining mental health in teenagers, particularly girls. Others push back on that interpretation. They argue that economic insecurity, academic pressure, climate anxiety, and systemic inequality are the real drivers. The truth is almost certainly that all of these factors interact with each other in ways that are still being mapped. What we do know is that the conversation itself is changing. And that matters enormously. Research consistently shows that stigma is one of the biggest barriers to people seeking help. When public figures like Simone Biles withdraw from competition to protect their mental health, when Prince Harry writes an entire memoir about his psychological struggles, when athletes, musicians, and executives openly discuss therapy and medication, it shifts what is considered acceptable to admit. That shift has measurable consequences. Studies show that mental health stigma reduction campaigns genuinely increase the likelihood that people will seek treatment. But access remains a devastating problem. In the United States, there is a shortage of approximately 7,000 mental health providers, according to the Health Resources and Services Administration. That means roughly 150 million Americans live in areas designated as mental health professional shortage zones. Wait times to see a psychiatrist in many cities now average 3 to 6 months. Insurance coverage for mental health services is notoriously inconsistent, and out-of-pocket therapy costs can easily run $150 or more per session, placing it completely out of reach for working-class families. This gap between growing awareness and insufficient access has fueled a surge in alternative approaches. Mental health apps like Calm, Headspace, and BetterHelp have collectively attracted hundreds of millions of users. The global mental wellness market was valued at over $120 billion in 2023 and is projected to keep growing. But critics raise serious concerns about the quality of these digital solutions. BetterHelp, for example, was fined $7.8 million by the Federal Trade Commission in 2023 for sharing user data with advertisers. And many studies suggest that app-based interventions, while helpful for mild symptoms, are not adequate substitutes for clinical care in moderate to severe cases. Here is a genuinely counterintuitive finding that the research has produced in recent years. Talking about mental health more does not automatically make people better. In some cases, a phenomenon researchers call co-rumination, where individuals repeatedly process and dwell on negative emotions with others, can actually deepen depression and anxiety rather than relieve it. This does not mean the mental health conversation should stop. It means the quality and direction of that conversation matters as much as the volume. The science of treatment itself is also undergoing a quiet revolution. Ketamine-assisted therapy has been approved for treatment-resistant depression and is showing remarkable results in clinical settings. Psilocybin, the active compound in psychedelic mushrooms, is in phase 3 clinical trials for depression and addiction. MDMA-assisted therapy for post-traumatic stress disorder has shown efficacy rates that dwarf conventional treatments in early studies. These are not fringe ideas anymore. Johns Hopkins University opened a dedicated center for psychedelic and consciousness research. The FDA has given breakthrough therapy designation to multiple psychedelic treatments. We may be on the edge of the most significant shift in psychiatric medicine in 70 years. The workplace is also transforming. Major corporations are now measuring employee mental health as a business metric. Absenteeism, productivity loss, and turnover linked to untreated mental illness cost the global economy an estimated $1 trillion per year, according to the World Health Organization. Companies are adding mental health days, expanding employee assistance programs, and increasingly treating psychological well-being as part of operational strategy rather than a soft HR concern. What does all of this mean together? It means we are watching a genuine revolution unfold in real time. The shame that kept millions of people silent for generations is losing its grip. The science is advancing faster than most people realize. The systems that failed those 57 million Americans are being pressured to change, and in some places they are actually changing. But the gap between what is needed and what currently exists remains enormous. Awareness without access is not a solution. It is the beginning of one. The mental health revolution is not finished. It has barely started. The most important thing you can take from all of this is that the conversation you are willing to have, with yourself, with people you care about, with your doctor, is not a small thing. Before you go, if you learned something valuable today, hit that like button right now. Subscribe to Trend Now Daily for a brand new video every single day. We will see you in the next one.